Hello everybody. Welcome to No1doctor channel. Today we will talk about one of the famous doctors, Herman Boerhaave, from 1668 to 1738. Boerhaave syndrome, ruptured esophagus. Herman Boerhaave studied philosophy in Leiden before studying medicine. He practiced medicine in Leiden, and was also professor of botany and medicine, contributing the botanical garden in Leiden. He also revived the Hippocratic method of bedside teaching of clinical medicine, and advocated autopsy to enable correlation of pathology with clinical symptoms. Boerhaave described the syndrome of ruptured esophagus in 1724 after performing the autopsy of Baron Jan Gerrit van Wassenaar, Grand Admiral of the Dutch fleet, who had died of the condition as a consequence of vomiting after a large feast 3 days earlier. Roykin recounts the following case. Some years ago I was on general surgery call and my registrar informed me that a man in his 50s had been admitted through a ND in a shocked state with terrible pains in the chest. He and his wife had been celebrating, and after consuming a fair amount of gin, they both enjoyed a large curry dinner. Shortly after, the patient in question started vomiting profusely, and this was associated with severe pain in the left side of the chest. X-ray of the chest showed opacification on the left side compatible with an oesophageal rupture. On thoracotomy, I found the lung collapsed and the pleural cavity full of strange small organisms approx. 1 centimeter in diameter and crescent-shaped. It was only after aspirating the contents of the pleural cavity that the smell of curry became distinctive and the organisms revealed themselves to be small prawns cooked as a vindaloo. There was a rupture of the oesophagus which I sutured, and drained the chest. The patient recovered well, and when sometime later I met him in Cambridge, he told me he had been climbing in the Himalayas, and that he had followed my instructions not to mix gin with a large curry. In the original description of the syndrome, the poor patient, Baron van Wassenaar, was in agony for a long period, taking an unconscionable time to die. Thanks for watching. Hope to see you again in more next videos. With my best wishes. Dr. 8 Fomid.